And so go ahead and tell us, let's get into the details of, you must have a passion for neurodevelopment disorders in infants. Tell us how physical therapists can affect that.
That has changed immensely over just in the recent 10 years. There is a assessment out there known as the General Movement Assessment, and it assesses these infants with a non-invasive assessment that's used using a 3-minute video of the infant, and then the therapist looks at that video to assess the infant's movements, because what's been found out is that that infants, even in utero, start having typical movements if their brain or their central nervous system is developing adequately and normally. If that brain, that nervous system, has been interrupted via something, a brain bleed, a lack of oxygen, infection, then those movements will not be typical. They will have abnormalities to them. And so being able to look at the infant in a 3-minute video, this assessment can be done up to about 5 months of age. After that, that window is no longer available. And so doing that assessment, we can determine if there's an abnormality in the brain, and it can even help assess to a certain extent the severity of that abnormality in the brain.
So should this be done with every infant?
Well, that's one of my passions. I don't know if you've seen my hashtag that says Stop CP or Stop Cerebral Palsy, but that is one of my dreams. I was thinking about this the other day, Shawn. When I was pregnant with my son, I remember being at the doctor's office and him offering me an amniocentesis. Why was he offering me that amniocentesis? To determine whether or not my fetus might possibly have Down syndrome, and then to offer me the option of an abortion. Now, this assessment will determine if your infant that is born and developing, if they are at risk of neurodevelopmental disorders such as cerebral palsy. And if so, intervention can be started immediately. So why would we not offer this assessment to every parent as an option?
Right, that makes total sense. So what is the physical therapist's role if there are abnormalities found early on?
That's another recent development that I have studied and trained in. Because of this passion of mine, I have chosen to travel around the world looking for those practitioners that I believe provide the best intervention for infants. And I located a neonatologist, Marina Solovicek, in Israel that developed a treatment for infants that are at risk of neurodevelopmental disorders, those specifically that because of interventricular hemorrhage or a brain bleed. And so this is one of the treatments that I offer for infants. This treatment is, again, non-invasive. It needs to start immediately within the window that I was sharing with you about up to 5 months of age, but the sooner the better. I usually start about 40 weeks, which is term, especially for the preterm and low birth weight infants. And the study that she had published in 2019 was of 4 infants that had grade 3 or grade 4 brain bleeds. Those are the most severe brain bleeds an infant can be diagnosed with. Provided this treatment, and those infants, the result was no cerebral palsy for these infants.
Wow. So of the 30 plus years I've been in healthcare, I have never heard of a physical therapist really treating infants at all, much less for neurodevelopment. So is this a fairly new phenomenon in physical therapy?
Well, Not necessarily. Probably the reason you don't hear about it is because it happens in the neonatal intensive care units, right? And so a lot of those therapists aren't heard from. They're not out in the public. They're hidden behind the hospital walls, right? Per se. So they do something that most people don't hear about. But this treatment, although it's been around for a long time, this neonatologist, even though the paper was published in 2019, those children were already 7 at that time. And she had developed that before the children were even born, probably 3 years before that. And so it's new, but this one is new. And probably I'm the only one that provides this treatment in the United States. She doesn't teach this in courses, as far as I know. I traveled to her hospital and trained with her for a week in order to provide this service.
So can you give us an idea of what some of the treatments are? I mean, please help educate me too, because I am really ignorant about this subject.
Yeah, well, it's a treatment that you manipulate the infant's body in the way that they should be moving instead of the way that they are moving. Their movements become very chaotic or stiff or spastic, and we don't want that to be their movements throughout life. It's hard to work and walk and play when you're stiff and spastic, but we want them to be smooth and gentle. And so we provide that movement periodically throughout the day for these infants and teach the parents how to do the same, because they're with the infants, 24 hours a day, or have a caregiver with them that can provide that. So that's in a nutshell what the treatment is, along with some other deep pressure sensations that we give them.
So you're basically in some ways trying to start muscle memory for the infants. Is that a correct way of saying it?
Yes, but more so with these infants that have had a bleed in their brain. Those neurological pathways in their brain have been interrupted. And so what we want to do is we want to maintain that muscle memory, as you were saying, while that brain bleed is resolving or new pathways are being made around that brain bleed. And so it's both. It's the muscle memory, but it's also affecting the neural pathways along with that muscle memory.
So is cerebral palsy usually caused from a brain bleed?
Well, in the United States especially, and other well-developed countries, what's being discovered throughout the world of neonatology is that infants that are preterm and low birth weight are more at risk for a brain bleed. And that brain bleed is then putting them at risk for neurodevelopmental disorders such as cerebral palsy. So infants that are preterm and low birth weight, their vascular systems are not well developed. So the stress that they might endure in life trying to be kept alive in the neonatal intensive care unit and cared for, the stress of crying, the stress of being startled, the stress of pain, all of that elevates their blood pressure. And just the elevation of their blood pressure can cause a brain bleed because their vessels are so fragile.
That makes sense. So from a pharmacist standpoint, when I think of neurodevelopment, and I might put you on the spot, and I apologize, Teresa. Remember, I'm a physical therapist. But when I think of neurodevelopment, I think of the importance of folic acid pre-pregnancy and during pregnancy. Is there any correlation whatsoever with folic acid and neurodevelopment and CP?
Wow. I would have to go back to my mentors, the people that I studied from, to ask them that question to find that answer for you, because I have not heard that discussion in any of my trainings, but that's a very interesting question. And I tell you, this treatment that I'm talking about, this movement imitation treatment, It only works so far with infants that have had a brain bleed. It doesn't work for infants that have had lack of oxygen, and that's the cause of their brain bleed. But we're trying to find out and develop some studies for that. So interjecting that question of the folic acid into those hypotheses for that study might be another link to finding more treatments for those infants that are at risk for cerebral palsy.
Yeah, my understanding is, folic acid is very important in neural tube development, and I don't know how if that necessarily links with CP or not.
Right. But I am right now writing that down because that is one of my other side gigs that I do is looking into the research for these infants. So I'm going to do some more research on that, and I'll actually get back to you on that.
Yeah, I appreciate it. Yeah, I really appreciate it.